Firstly, welcome to everybody who's joined the call today for the Student Leadership Programme webinar on the Personalised Care Institute. This webinar is supported by Health Education England, and it's also open to our 150 leaders, but also students across the UK. So welcome to everybody for joining. With us, we have Dr. Emma Hyde, who is the Clinical Director at the Personalised Care Institute. By background, she's a diagnostic radiographer. And we're delighted to have her with us today to speak about the Personalised Care Institute. And I know she's also going to be doing a bit of a little bit about her as well before she gets fully underway. With us, we also have Becky Williamson and Heather Simpson, who are also going to be joining for the Q&A at the end. So if you do have questions that you'd like to ask Emma or Becky or Heather, please do so in the Q&A or in the chat. You're also welcome to say hi to each other on the chat if you want to. Have a conversation, have a discussion about the presentation. So we're going to have a presentation about half an hour-ish, and then we'll go to Q&A after that. So without any further ado, I'm going to hand over to Emma.
Thank you very much, Nadia. Hello, everybody. So as Nadia said, my name is Dr. Emma Hyde. I always start everything that I do with hello, my name is, and you'll hear a little bit later on why that mantra is so important to me. Felix, could we move on to the next slide, please? So as you've heard, I'm going to tell you a little bit about me first. So the first thing, as Nadia pointed out, I'm a diagnostic radiographer. So I was a healthcare student back in the day, back in the 1990s, too many years ago now. I qualified from Sheffield Hallam University with my BSc Hons as one of the first cohorts of degree educated diagnostic radiographers. I spent 10 years in clinical practice after that, working in the NHS, starting off at obviously the equivalent of a band 5 as a newly qualified radiographer, and then progressing up into senior radiographer roles, as they were called at that time, rather than bands 6 and 7, and specialising in CT and MRI practice, which I absolutely loved. One of the main reasons I loved CT and MRI so much is because it meant that I had longer time to spend with the patients that I was caring for. I really enjoyed that longer interaction, whereas in the main X-ray department, which the majority of my work had been before that, my interactions obviously were much shorter with patients because X-rays are quite quick in comparison. So when I specialised in CT and MRI, I realised I'd found my home and very quickly settled in there. The longer I spent in CT and MRI, though, the more I started to think about concepts of patient care, the more I started to think there's more we could do as a profession, as radiographers. So in 2006, I actually moved into the University of Derby. So I've been teaching at the University of Derby now for nearly 17 years. So to start with, I was very, very hands-on in terms of doing lots of practical sessions in the X-ray room with students, lots of teaching, going out to placements and doing placement visits, doing all sorts of different marking assessments, etc., etc., etc. But over the years that I've spent at Derby, my role has changed. And I'm now in a senior leadership role within the organisation as an associate professor. And that has come about purely from becoming much more research active. So the big change now is that I still teach and I still love teaching. I don't think that's ever going to go away. But now I'm an associate professor. And that came about because of all the research that I mentioned that I've done. So I just want to tell you a little bit about that briefly before I go into talking about the Personalised Care Institute specifically, because that research actually directly led me into the role with the Personalised Care Institute. So what happened was, as a more junior lecturer, when I came into teaching, I started to look at the transition process that student radiographers went through when they moved from the academic environment of the university to when they went on clinical practice. And what I noticed was that they found that transition really difficult. So when I completed my master's in education, I actually chose to focus on that for my independent study, for my dissertation. And what came back loud and clear from the students that were involved in that research was that there was a real dissonance between the theory that they were taught in the university and the practice that they saw out in department. And one of the biggest areas of dissonance was around very ill patients or very injured patients and how to deal with those. And that really got me thinking, well, how do we actually measure that as radiographers? We know what good care likes if we're a nurse. We know what good care looks like if we're a doctor, because there are lots of documents and there's lots of research telling us what it looks like in those professions. But at that time, there was nothing out there at all for radiographers. It was an absolute desolate wilderness in terms of research around good care for radiography. And that really got me thinking. And so it led me into my PhD project, which was actually to define informed measures of patient-centered care in diagnostic radiography to fill that gap in the research. So I spent 5 years working towards that goal as a part-time PhD student, juggling family, work, and PhD level study. It was tough going, I have to say. But I got there in the end, and you can see me with the massive grin on my face in that photograph in the bottom right hand corner of the slide. That's me at my graduation ceremony receiving my PhD. So that research really did open up my world though even further. So I was really immersed in this area of what does person-centered care look like in radiography. But once I got it, I started to then get involved in lots and lots of projects that were wider than radiography. So they were multi-professional. So I did a number of projects which were looking at delivering training or evaluating aspects of care that weren't in my own profession. They were across multiple different professions, but perhaps located within a particular organisation, such as an NHS trust. Or I did do some work at actually an ICS level, an integrated care system level as well. And that really, again, broadened my horizons out. And then something landed in my lap as a result of some of those contacts that I made through doing that research. I actually became aware of the Personalised Care Institute, which was very new at this point, and became aware that there was a role there that was out to advertisement for a clinical director. And so I threw my hat in the ring, not really sure what to expect, thinking, I don't know if I'm what they're looking for or not, but I was actually appointed into that role. And started that role at the beginning of this year in January 2022. So I've been doing that role nearly a year. I'm clinical director of the Personalised Care Institute 1 day per week. So they buy me out of my university time. The rest of the week, I still work at the University of Derby as an associate professor. But 1 day of the week, I'm purely dedicated to all things personalised care, which has been a fantastic opportunity. And I feel really privileged, not just because it's a great role to have, but also because I feel very passionately about the fact that it's not a medical member of staff in this role. Clinical director roles, I don't know how much you're all aware, but the tendency is clinical director roles often go to medical members of staff. So for a nurse or an AHP to get this sort of role, it's not that common. So I'm incredibly proud to be in that position as a diagnostic radiographer and flying the flag for healthcare professionals. Could we go to the next slide, please, Felix? Thank you. So you may be sitting there thinking, well, I've heard about personalised care, I've heard about the Personalised Care Institute. What is that though? And hopefully you're here because you want to find out a bit more about that. So we know there's lots and lots of evidence out there about how personalised care can help to tackle major health challenges. Research published has shown repeatedly that it improves patient outcomes in terms of their recovery from illnesses or their management of long-term conditions. It reduces repeat appointments, so particularly pertinent in primary care settings and the burden on the GP system. It improves communication with risks through the use of shared decision making. And alongside that, it supports proper informed consent, where all of the risks, all of the benefits of different treatment options are explained in detail and a joint decision is reached. It also has a big role to play in reducing health inequalities, and we know that there is a massive focus on health inequalities at the moment, which there absolutely needs to be. The current cost of living crisis is significantly exacerbating health inequalities, and so there are lots and lots of pieces of work going on at the moment about trying to find ways to reduce those health inequalities and improve population health. Personalised care plays a key role in that as well, through those quality conversations that I've talked about when you're having shared decision-making conversations, but also the fact that healthcare professionals are often in a position where they can pick up on things in people's home settings or in conversations with individuals, that may not necessarily get picked up in a hospital setting, for example, or in a GP surgery consultation. So it's got a big role to play, massive role to play. Now, we also know that from the GP patient survey that was carried out this year, that lots of people are really keen to be more involved in their own care. And I think that's particularly important when we think about the sorts of long-term conditions that personalised care is used to help manage. When we think about the fact that long-term conditions are conditions such as cancer, diabetes, mental health conditions, we start to see that these are not things that are going to be a short illness for somebody. They're going to require managing for probably months, if not years. So the GP surgery really did emphasise that people want to be more involved in their care. They want to make decisions, and I think that's crucial to being personalised. Disappointingly, though, it also showed that about 10% of people at the moment feel that they're not at all involved in their healthcare decisions, and clearly that's something we want to change at the Personalised Care Institute. And focusing specifically on those people with long-term conditions, 40% of the people that were in the GP contributed to the GP survey want more support to manage their own health and well-being on a day-to-day basis. So I think it's all forming, hopefully, quite a compelling picture for you to show you why this is so important. We also know from the Personalised Care First survey, which was conducted back in 2021, which was research of nearly 4,500 appointments, that when patients feel they've received personalised care, they're significantly more likely to understand the advice they've been given during that interaction. They are significantly likely to be more motivated to follow it. So whether that's adhering to an exercise regime, a medication regime, they're significantly more likely to find it easy to follow. So to actually understand what needs to happen and to comply with that, to feel more in charge of their own recovery, and to feel listened to and valued. And that's really, really key, isn't it? As healthcare professionals, we want to treat everybody we interact with dignity and respect, don't we? So listening to the people that we're caring for, valuing their perspectives and opinions is really, really important. So absolutely fundamental to personalised care. So that's a flavour of the case for personalised care. Now I want to talk to you a little bit more about the Personalised Care Institute itself and what it has to offer. So Felix, if we can move on to the next slide, please. Thank you. So to introduce the Personalised Care Institute to you all then. So the Personalised Care Institute was set up in 2020, but launched September 2020. It had been in development for roughly a year before that. It was commissioned by NHS England in 2019, but obviously it takes time to get things up and running. So it actually launched in 2020. And it's the home for Personalised Care Institute, Personalised Care Education in the UK. It has a growing number of free e-learning modules, each of which have been co-produced and peer-reviewed by national subject leaders. Each module takes around 30 to 60 minutes to complete, so they're nice bite-sized pieces of learning. Alongside that, we aim to be the voice of personalised care by building a community of practice, so engaging people in a network that is passionate about personalised care. And we do that through co-producing and delivering blogs, podcasts, webinars, and curating resources about all things personalised care. We have numerous partners. So at the moment, we have over 40 Royal Colleges and professional healthcare associations that are part of our steering group, that partner with us. And we work with them to provide a whole range of services, all linked to personalised care, and all trying to improve the experience of people receiving care in the UK. I've just seen a really good question pop up, and it was actually one I was just going to mention. So thank you to Amber for this one. Amber's asked, can you use this e-learning as CPD for revalidation? And I was just going to come on and explain that at the end of the free e-learning modules, you do get a certificate of completion, which you can download and put in your CPD portfolio. And I know as many of you might be pre-registration students that are training to become healthcare professions, or some of you might already be qualified healthcare professions that are perhaps doing further study. I know this will be really important to you. So yes, just to reassure you, at the end of the e-learning module, you can download your certificate, put it in your portfolio, use it for revalidation, or if you're a member of a profession like me, that is registered with the HCP, so you can put it into your CPD audit collection. So, oh, lovely. If we can just go back to the steering group, sorry, Felix. Lovely, thank you. So I mentioned there's around 40 steering group partners that we're working with at the moment. This slide just gives you a flavour of them. I won't read them all out because obviously that, you know, you can see them all there. It's nice and visual, and hopefully from getting a glance at it, you can hopefully see at least one or two that resonate with you. But just to point out what a range there is, I think that's a really, really important thing. There are a number of different professional bodies and organisations linked to medicine. There are some linked to nursing. There are some linked to allied health professions. The message is there's somebody there, whatever your profession, you should be represented. We also have representation from key people that are involved in delivery of some of the personalised care specific roles, and I'm going to talk about these in a moment's time. But I'll just flag on this slide that you can see the National Academy for Social Prescribing, the Coalition for Personalised Care, and the National Association of Link Workers, all of which are integral to some of the roles linked to personalised care. So Felix, if we can go on to the next slide, and I think that will take me on, or not quite. So yeah, so just a little bit more about the modules, and then I will talk about those 3 roles. So as I mentioned, we've got 6 online modules at the moment that are available free of charge to anybody. So it doesn't matter what your role is in health or care, what type of setting you work in, whether you're in an acute NHS trust, whether you're in a GP surgery, whether you're working in the voluntary sector, you can be working anywhere. You can be student, you can be newly qualified, you can have been working for 15, 20, 30 years. Anybody can access them, and we encourage everyone to access them. We do stress that these modules are suitable for all levels of seniority and experience, and we do get a really, really wide range of people accessing these courses. Now, I would say probably for you all at the moment, it's the first 3 ones from the left-hand side that are probably going to be relevant to everybody. And then the second 3 on the right-hand side of the slide will depend on your role. So looking at the left, we've got the core skills module, we've got the shared decision-making module, and we've got personalised care and support planning. And I would suggest that these are brilliant starters in terms of learning more about personalised care, picking up hints and tips about how to embed personalised care into your own day-to-day clinical practice, and really starting to think about personalisation as a concept and how we embed that as business as usual. If we think about some of the really key campaigns that have happened over the last few years in terms of personalising care, delivering good care, we've got lots of examples. We've got making every contact count, so thinking about how to maximise an interaction with an individual. We've got what matters to you, and making sure that we are tailoring our care to what is important to the individual. And we've got Hello, My Name Is, which is about that basic foundation that I mentioned right at the beginning of this presentation, about always introducing ourselves to individuals and setting that really equal footing right from the start. So these 3 modules will give you a really, really good grounding in all of those approaches, about thinking about the core skills, quality conversations, and quality care and support planning. They only take between 30 and 60 minutes, as I said a moment ago. They can be completed at your own pace. You can pick them up and put them down because they will save your progress. They're online, which means they're accessible 24 hours a day, 7 days a week, so you can fit them in whenever you want, and they are completely free to access. There's no charge to anybody for accessing these resources. I've talked about the certificate of learning that you can download at the end of it. For medical students, they can also download CPD points as well, which is obviously important to them and their revalidation processes. And for everyone, you can also download a completer badge. So you get a nice little completer badge, which you can put on your email signature or share on social media as well to show that you've done this course too. The other 3 e-learning modules that we have at the moment up there are obviously very dependent on role. So we've got personalised care and support planning specific for maternity services, which is the name implies is very specific to those working in maternity. So if you are a midwife, student midwife, or midwifery support worker, then this is going to be one for you for sure. We've also got a junior doctor specific one, so that's trying to encourage the next generation of doctors to be leading from the front and embedding personalised care as part of their practice. So obviously that's specific for the junior doctors. And then we've got our remote consultations module, which is brand new and only been launched a couple of months ago. And clearly that's for people who are working in roles where they are remotely consulting with people. So for example, you might be a physio who's running a remote MSK service and triaging patients through remote consultations. You might be an OT doing some sort of assessments in a similar way. There's all sorts of different people doing remote consultations, and that sits there and is open to anybody who's in that realm. So I think we're ready for the next slide, please, Felix. So I said as well, I just mentioned a little bit about the accredited in-depth training that we have for the personalised care Pacific roles. Really for you as the 150 leaders cohort, or students that are keen to find out more about all things leadership, it's about you being aware of these roles and what they have to offer. Because you've probably already got your own professional identity. What I want to do here is just sort of explain to you what these roles are and how they might link into you. So there are 3 key roles linked to personalised care, called the health and wellbeing coach, the social prescribing link worker, and the care coordinator. So these 3 new roles were created when personalised care was launched as a concept, as a way to try and make some of the embed some of the aspects of personalised care which didn't naturally perhaps fall into existing healthcare professionals' roles. So it was about trying to bring that specific knowledge base in, but also as well free up some capacity, particularly in primary care services and particularly for GPs, because some of the things that these 3 roles do would have previously fallen very much to GPs to do. And we know the pressure on GP systems. So this is a way to try and relieve some of that pressure and provide better, more personalised care for people. So health and wellbeing coaches, as the name implies, offer diet, exercise, lifestyle advice to people to try and support them with their own health and wellbeing. So a big role to play, for example, in managing people with diabetes, helping people with diabetes to self-manage their own conditions. We have social prescribing link workers who work with a whole range of people, but for example, may work with somebody with a mental health illness to help find them social activities within their local community, such as gardening groups, walking clubs, communities that come together, for example, a Parkinson's support group. The social prescribing link worker will try to link those individuals up with things that are happening that may help them to feel better. It's not a medication prescription, it's a prescription for social activity to help them improve their health. And then the care coordinator is particularly useful for people with complex long-term conditions and also people who have got multi-morbidities. And it's about helping them to manage the numbers of appointments and care interactions that they may have and support them with that. So those 3 things, as I say, may have previously fallen quite heavily at the door of GPs. And by creating these new roles, it takes their burden off and then provides an opportunity for more personalised care. Now at the PCI, we actually accredit a number of third-party training providers to offer training programs to train people for these roles. At the moment, we have about 70 different training programs on our books, which we've accredited so that they meet our needs. And they offer a range of different training. Like I say, my purpose for telling you about them today is so that you're aware of them. When you come across them in clinical practice, you know what they are, and you know that the value they add to personalised care. And you can think about how you could potentially work with these folks as well, because they have a massive role to play in improving patient care. So I think we're ready for the next slide, please, Felix. Okay, so this is just a little bit of feedback that we've had from healthcare professionals that have completed the personalised care e-learning courses. So to date, we've had about 40,000 people now complete one or more of our courses. So we've got a big pool of people to pull data from, but that our evaluations have been overwhelmingly positive, which hopefully proves to you the value of looking at our offer and thinking about doing some of our courses. 90% of the people that have completed our training so far have said that it will have a positive impact on their daily practice. 84% agreed, strongly agreed, that the training has helped them develop the current skills that they have. 87% said the training introduced them to new models or approaches that they'd like to use in their practice to be more personalised. 85% said that they would recommend the training to another professional, and 87% said the training materials were of very good quality. So just some evidence there of the high quality of the resources that we have to offer to you all. And if we can go on to the next slide, Felix. Okay, so a little bit of a change of topic now. So I'm going to talk a little bit about some leadership training that's available to you all as well, that runs alongside the Personalised Care Institute offer. So as I said earlier on, the Personalised Care Institute was commissioned by NHS England. NHS England have also commissioned the Leadership Personalised Care training. So the two sit hand in hand. So Personalised Care Institute offers, obviously, as I said, the fundamental building blocks of personalised care and what you need to know to get started and deliver personalised care. But for those of you who find you've got a real interest in it, and for those of you with leadership aspirations, you may want to actually look at the Leadership for Personalised Care offer. So I've just got a couple of slides here to tell you a little bit more about it. And I've also brought with me today Becky and Heather from the Leadership for Personalised Care team. So they're on the call and they know far more about this than me. So if you have questions about this, I've got them there ready to answer your questions at the end. Okay, so in terms of leadership for personalised care, the first thing to establish is what skills and qualities are needed. And obviously, it's really, really important to be personalised and to deliver leadership and personalisation. You've got to be authentic, you've got to be present, you've got to have an open mindset, and you've got to be bold and courageous. It's about being the change you want to see. Relating and communicating is really important. You need to be able to build relationships, and often you need to build them very quickly in these situations. You need to build trust, rapport. You need to collaborate with people, and absolutely fundamentally, you need to be co-creating. So it shouldn't be leadership doing things to people. It should be leadership empowering and co-creating with individuals. There should be leading and visioning. There should be a shared vision in terms of what wants to be achieved. There should be understanding of the community that you're working with, thinking about how to influence systems and thinking about how to lead and enable others. Really, really important, and quite a mind shift change for some people to manage in that way. And then delivering, there should be ownership, accountability, and a clear structure for delivery of personalised care. And wherever possible, exploring creative facilitation. This is really, really important because it really does engage people and opens things up. What we're trying to achieve with the Leadership Personalised Care programme is somebody who creates the conditions for change to happen. They allow personalised care to take root, and they embrace that co-production with communities. So there is a little link on the bottom of the slide which does tell you more, and you will get a copy of these slides after the presentation so that you can follow this up and have a look. But Felix, if we can go on to the next slide, please. So the Leadership for Personalised Care programme does have lots and lots of resources. As I said, you're going to get slides after this session today, and there is some recordings on the YouTube channel that the Leadership Personalised Care team run. You can click on to straight from the PowerPoint. There's also some flyers on here with more information about the offer. There are 4 modules in the Leadership Personalised Care programme, and obviously there's detail about what's in there. There is a really comprehensive website for the Leadership for Personalised Care team. They are very, very active also on Twitter and LinkedIn as well. So please do feel free to go and check them out and find out a little bit more. This could be a really instrumental part in your leadership journey, so it's worth having a look. And similar to Personalised Care Institute, everything's free of charge. So there's no barrier to entry in terms of costs of programmes. All it is whether you have got the time, enthusiasm, and motivation to take part in these programmes. So Felix, if you can move us on, I think I've just got one last slide with lots of contact details on. Yes, thank you very much. So if you would like to find out more about the Personalised Care Institute and what we have to offer, I've popped my Personalised Care Institute email on there, and also my Twitter handle and the Personalised Care Institute handle. I've also put the website there again as a little reminder that all of our resources are available free of charge on there. In terms of the Leadership for Personalised Care training offer, then the email address for the team is on there, and also their Twitter handles, so that you can get in touch with them direct too. And as I said, they're really active on social media, on Twitter and LinkedIn, so their LinkedIn page is there too. So I think I'm probably about done in terms of presentation. So I'm going to pause now and be quiet for a moment and see what questions you've got for myself, Becky and Heather about the Personalised Care Institute or the Leadership Personalised Care offer. Thank you ever so much for listening. I hope this has inspired you to get involved in the personalised care community, and I look forward to seeing you all be the change that you want to see in terms of healthcare services. Thank you.
Thank you, Emma. That was really, really useful. And I think your point about making sure that you have you're inspired and enthusiastic about doing it is key here. So I know that there will be people on the call that are exactly that. Whilst you were talking, there's been a lot of questions.
Okay.
I think some I think have been answered as we've gone along. So I'm trying to work out if I can group a few of them. One more recent one that we had, I think, was about what you were talking about with the leadership skills, and you were talking about the community aspect. And someone's commented here that I think the community aspect is really important, in being able to understand different backgrounds and diversity, without making the assumptions about people. And I think it's probably something that's applicable to all professions and professional backgrounds. One person has given a very specific question, so I wonder if you could give any feedback on this. Are there any suggestions of how a student SLT, speech and language therapist, may be able to embed personalised care more as a student?
Absolutely. Well, I think as a student, you're in a really privileged position, because hopefully you're working with supportive mentors or supervisors that understand you are a student, understand perhaps things might take you a little bit longer, and are able to give you the headspace to think about your practice a little bit more than may happen when you're qualified. And I say that knowing the time pressures that we're all working under, knowing that usually there are very fixed appointment times for interactions like speech and language therapy, or in my own profession, radiography, we're certainly hugely time pressured there. But being the student, I hope that the people you're working with are giving you the headspace to sit and think, and to have those quality interactions with patients without trying to rush you through the process. That's certainly what I would do in my own, if I was working with a student, that's what I'd be doing. And I hope they're doing that too, which then means you've got the time to think about what you want to ask the person, what you want to find out from them. As I said during the presentation, saying, hello, my name is Emma, is such an icebreaker, and it's so important, and it changes the relationship immediately into one of people that are respecting and getting to know each other, rather than there being a power dynamic between the person receiving care and the professional delivering the care. So hello, my name is fundamental. And then I think the next really key thing I would always encourage people to do, especially students, is to try and find out what's important to the individual, what matters to them. However you ask that question doesn't really matter, but the nub of it, what matters to that individual, is the really important thing to try and get out of them in any way that you can. So perhaps picking up on, perhaps they bought a particular bag with them, or wearing a certain piece of clothing, and that gives you a clue. So I'm thinking of things like, for example, perhaps they've come with a particular sports team's shirt on, or something like that, something that gives you a hook straight away to try and get an insight into what might be important to them. And it's about trying to uncover that, so that can then give you some massive help in terms of actually tailoring and personalising the service to them. It's amazing how many times just incidental conversations can actually lead to a really significant understanding. I talk to my students, for example, about an example where we had a young woman waiting for an ankle x-ray, and she was getting more and more agitated, and the assumption was it was whether the ankle was broken or not. Actually, when somebody stopped and had a conversation with the person, it was about the fact that she was a young mum. She wasn't just a young woman, she was a young mum, and she was getting really concerned about getting to school in time to pick her children up, because who was going to pick them up if she couldn't get there? So it's not, what I'm trying to prove with that example is it's not even just about what's happening in that care interaction. It could actually be all sorts of other things in the person's life that's happening around them. But what I will do now is just give Heather and Becky a chance to come in and add their thoughts as well, because I think that would be really helpful.
I think you put it really nicely, Emma, about asking what matters to the individual. So kind of moving away from what's the matter with you to what matters to you. So really finding that human connection around what's important to you, what can we work on together to improve things. So my background is occupational therapy, and I've moved into a leadership development role. But really that kind of person-centered practice that we always talk about, keeping the person at the center of everything you do, is really important and is really at the heart of personalised care.
Yeah, just to build on that, so hi, Heather. So I head up the Leadership Personalised Care programme, and similar to Becky, we started the same space as occupational therapists, and then I worked in, I know a lot of the questions are around where, you know, where's the place that you work and how can you be delivering or enabling personalised care across the community, etc. So my clinical role, as I'm sure many of yours will be, spanned the whole system. And ultimately for me, it's less about where you are, it's more about how you are. And I think that goes back to what Emma's been saying. And it's interesting, we've been doing some research. We're in the presence, in the midst at the moment of doing some research with Institute of Employment Studies about our programme and the impact. So we've got a lot of impact in terms of its efficacy on the individual at the end of programme, etc., particularly using the leadership framework that Emma introduced you to. But more specifically, and what's most important to me, is the so what. So what 6 months down the line and a year down the line, what's that enabled individual growth to go on and make a difference to people? And what we're seeing is that it's changing a lot, which is fantastic. Our report will be out early next year. But what's really interesting, particularly from a leadership perspective, is that impact is greater where people believe they've got a leadership role. Now, my view is that every one of you are already leaders. The fact that you're on this programme, the fact that you're already interested in this stuff demonstrates that. So, you know, as students, you're already leading on this. You know, you can be the leader in that person's care. You might be the only person that, you know, introduces yourself in the hello, my name is, and asks them the question is what matters most to you. And actually, by doing that, you're a leader.
Thank you, Heather. Thank you, Becky. I've had one question that's kind of, I guess, counter to what you've just been talking about in terms of making the time to have those conversations with staff. So one question is, how does personalised care work out of hospital settings? And at a time where patients are being seen by quickly by different staff, how can we make sure that that dedicated time is there to support and empower the patients to make their own decisions? I don't know who wants to take.
To start on that, Emma, I'm happy. So Emma introduced the role of health coaches earlier, and the health coaching journey has been around quite a long time. So I'm an accredited health coach trainer, which has supported the setting up of a website called Holding Better Conversations. So essentially, as clinicians, how do we make the most of those interactions that we have? You know, whether it's 5 minutes, whether it's an hour, and fundamentally coaching skills. So how you have that interaction. If you've only got 10 minutes, you know, we don't have control over how maybe our clinics are scheduled or the slots that we're told to get through in the day with people. What we have control over is how we make the difference in that space. And, you know, my view is that holding a coaching approach within that space as far as possible, starting from that position, absolutely, and as far as possible, basically, obviously working with the preferences of the person that you're with as well, you know, helping them to make as much of the decisions, the outcomes will be wholly better. We all know, like, we don't like being told what to do. But actually, if we feel we've been involved and been part of that decision, we're more likely to go on and enact it.
I'll come in after that, if that's okay. I just wanted to mention what we mean by coaching. So coaching is really asking those open questions and kind of not giving direction, but inviting the individual to take ownership for the answer to the question. So that's really what we mean by coaching.
And I'll just finish off then, if that's okay. I mean, going back to my own profession, and this is it's not unique to radiography, but I think in radiography it's a really good example of severe time pressure. Sometimes our interactions can be less than 5 minutes in terms of how long we have got, for example, to do a chest x-ray. We may have 2 minutes. That's the way how tightly some of our bookings are packed. But I would argue it doesn't matter how long you have, you can always be person-centered and deliver personalised care within every single interaction. Because if you start with hello, my name is, if you give good eye contact, if you listen properly to the individual, you are delivering personalised care from doing that. So even in a really, really short 2-minute interaction, you can do it. And I truly believe that. I don't think there's any, and I'm going to say excuse, which is probably a bit controversial, but I do think sometimes people use it as an excuse not to do it, because actually it does require a bit of effort. It requires you to be engaged, to be present. And I used those words a few moments ago, talking about the leadership, the personalised care stuff. You know, you do need to be present. And I think that's quite a mind shift. I'm speaking too fast again. It's a mind shift change for some people working in health and social care, because they've got very used to quite an industrial model which treats people as the next person on the conveyor belt to see. And I think we have to be the agents of change that stop that. And we start to treat people in a personalised manner and not as the next person on that conveyor belt, because it's not good for them and it's not good for us. And there's lots and lots of evidence to show when we start delivering more personalised care, better interactions with our patients, not only did they feel better about it, and as Becky and Heather have said, more willing, able and confident to buy into the treatment or advice that they've been given, but actually we get better job satisfaction from it as well. And in a time where we've got so many health and social care professionals suffering from burnout, from stress, the legacy of the pandemic, and now the continued pressures with backlogs and waiting lists and winter pressures now on top of that, then that's really important. We need to get back. What was our reason for coming into health and social care in the first place? We need to reclaim that, and we reclaim that by being personalised and delivering excellent care.
Thanks, Emma. And I think you also preempted Priscilla's question. As she says, a diagnostic radiography student, lots of the time is taken up by in general x-rays. So how can we make it more personalised with that limited time? Priscilla, I've allowed you to talk. If you want to add anything, now is your chance. If not, I'll assume the question's been answered. Well gone, Priscilla.
Hi, thanks so much. Yes, I think you have rightly answered this question, actually, in terms of just the hi, my name is, and just introducing just eye contact. So thank you very much for that.
Thanks, Priscilla. Good luck with your studies.
Thank you.
I have a question from Amber. Amber's asking, does the Personalised Care Institute have research opportunities?
Sorry, I had to cough, so I had to put myself on mute quickly. The Personalised Care Institute does carry out research, yes. So at the moment, we've got a very big evaluation project running that we're collaborating with Imperial College in London on. But I'm guessing what that person was probably asking about was perhaps opportunities for them to do their own research. And if that's right, and if that's correct, please feel free to drop me an email. And you've got my email address on the slides, and we can talk about exactly what it is. I'm guessing that it might be something like perhaps an independent study project idea or something like that. And if it is, really happy to have a conversation and see how we could work with you to support that.
That's great. Thank you, Emma. Amber, I know you're, I hope that helps, and definitely take up the offer, I would suggest. She's there, but she's on mute, so I'll leave her to it. Thank you. I've got a question here about how students can better influence and encourage other people as I guess, you know, we're looking at a group of people here who are our new leaders. How can they better encourage other people, particularly people who have been working in health and social care for a long time to maybe embrace that a little bit more. One person says that it feels like there's a lot of resistance to taking the time to understand patient concerns. I want to be a better leader and advocate. Do you have any advice around this and helping others to follow?
So I think the key thing is do it yourself. Don't be discouraged or dissuaded by anybody who tells you not to do it. Clearly don't be rude to them because that's not a very person-centered or personalised, is it, to be rude to anybody. But if someone's trying to tell you you haven't got time for something, I would just politely say, challenge them back and say, well, I think I have, and carry on and be the change you want to see. Now that takes strength and resilience. I'm really aware of that, and that might be easier in some situations than others, depending on the personality of the individual who's saying you haven't got time. But I would encourage you to challenge them back. That's first and foremost, in a polite fashion. I would also encourage you to try and spread the word. So, being a change agent, part of that is about getting that message out there. So it might be you are perhaps a student rep for your university, so you can talk to your cohort of students about what you found out today potentially, and share information about the training offer that we've talked about, and get people on board that way. You could potentially use social media if you're active on that to get the message out. When you qualify, if you're not already qualified, you can be out there practicing as a newly qualified healthcare professional and being the change you want to see. And throughout your career, it can be your mantra, a little bit like it's always been mine, and probably Heather and Becky's too, I'm sure.
I absolutely.
As well. Oh, sorry, Becky.
Okay. I was just going to say, I absolutely agree, Emma, around being that role model and showing others the way of how to do personalised care well. And I think also other opportunities you get, like presentations on placement and things like that, bringing personalised care into the work that you're doing. And if you ever do kind of team teachings when you're qualified, those kinds of things, bringing in those elements of personalised care into your presentations is always a good idea.
Yeah, and I guess what I was going to say was really never underestimate the influence and the power you do have to make that change. So I think back over my career, and I think back to when I was supported students in practice in my clinical work, and then when I was an AHP professional lead, I held the grandparent role for 50 preceptees in our organisation, and I was always absolutely in awe of the freshness that people brought. And something you bring and something you can say can shift mindset in the moment. I know that because it helped me stay focused and centered at times when you're pulled in so many different directions. So I just really encourage to not limit the potential that you believe you have in influencing others.
Thank you. That felt like a really nice note to end on, but I've actually got one more question. So if that's okay. I think this is in relation to one of the first module that you were talking about, that you offer about the core skills. I'm going to amend the question slightly, and I think for all of you, what would you say is the most important core skill required for somebody to embrace and practice personalised care?
Shall I kick off and then, yeah? So I would say listening, being an excellent listener, and really, really hearing what people are telling you about what's important to them, and respecting and valuing and acting on it. But listening is the key, because if you don't listen, you can't do any of the other things after that.
I think from my perspective, it would be being inclusive. So really valuing people for who they are. And that comes along with what Emma was saying around listening.
And just to layer on to both those things, believing in people's potential. We're so often boxed in ourselves in clinical roles with systems and processes that are around us, which can sometimes get in the way of us seeing the possibilities of potential. So holding that belief.
Amazing. Thank you all so much. Just final opportunity for anyone else to ask anything. You're welcome to speak as well if you want to raise your hand. Give a second. I will assume not, but you know that you will have the contact details for Emma, and also the wider team. If you do want to ask any questions and get in contact about anything. But that leaves me to thank Emma for her presentation and also for joining us along with Becky and Heather this afternoon. Sorry, you can see my voice is struggling to stay afloat there. I think that was really, really useful and really valuable to those. We'll make sure that we send around the slides to those of you who are joining us, so you can catch up, and there's lots of links available on the presentation, so please do check them out and share and promote to others that you think will also be interested in learning more. Felix has put up a poll, so if you can fill that in quickly, that would be really great. Emma, did you want to come in quickly? I can see.
Yes, sorry, I didn't want to lose the opportunity to wish everybody that's on the call really good luck with their studies, because I know their students either at pre-registration or post-registration level. So good luck with whatever stage of your career you're at, and thanks ever so much for coming today.
Thank you so much for joining us, and we look forward to seeing you soon in the future. Thank you so much, everyone. Take care.